Well, it's really tough doing a science talk after dinner. It's really tough following children on a video, but I will do my best. That was just absolutely fantastic, and I am just in awe of what is in this room. So if we can get I guess we have the lights up a little bit. So if you don't know me, and you don't, I like to start with bold statements. And so my title is quite simple for the talk: Let's Change Medicine. Okay, that's all I want to do. That's why we're here, is to change medicine. Fairly simple. If I can have the next slide. So everybody's making a big deal. I want the lights to come back up. If everybody's making a big deal about us being there. No, go back to the blank slide and the lights up. Oh, I have control. Sorry, I forgot about that. That's what happens, you know. You have a good team around you, don't even have to use this anymore. So I want to start off with, how did we get in this room? So I don't think things happen by chance. So how did we get in this room? And I'm going to say that the people in this room, you're not here accidentally, and I'm hoping that you're going to help change medicine. And I promise to impact you before we leave. So first of all, I want to thank Jim Hudson. Jim Hudson and I have known each other for 25 years. And almost 20 years ago this week, I accepted a job to be the Chief Scientific Director at Research Genetics. And I held that title for 2 weeks. And I changed my mind, and I said, Jim, I'm really sorry, at a Cold Spring Harbor meeting, I can't come. I have to go to the Medical College of Wisconsin. I think it's better for my family. And something felt like I had to do something. And I thought it was just family. And I'm going to say that maybe the journey was I had to do something first before I came back here. And I'm just going to posit that out there. In the room, we have the Dean of UAB, who was born in Huntsville. And he's the Dean of the medical school just south of here. We have Lonnie McMillan, who probably didn't know anything about genomics and genetics when he got involved, who helped put together this enterprise. We have Mark Smith, who's not with us, but who helped make that building absolutely fantastic. We have a world-class faculty that's here. Okay? You've just heard a little bit about them. I have team members that have come from Texas, Scotland, Alabama, and she's part Indian. That's Liz, how do you get from Scotland to Huntsville? We have Joe Lazar and Jela Lazar, who came from Slovakia. We have David Bick, who's coming from the East Coast. We have Kim Strong, who decided to come here through Australia, where she picked up her husband and brought him back. We have Jill, who is leading our business side, who was in Chicago, in Texas, and who's there. And then we have the rest of you who have come in here. Now, how many of you shook my hand when I was here the last time? Okay, so it's all your fault that I'm here. So with that, I'm going to go on. So the reason we're here is you and what's here. So I want to just say to Jim and to Lonnie and the faculty, it's not about us. I want to thank you for inviting us, because this is where it's going to happen. And so with that, I'm going to tell you a couple of stories. So first of all, a lot of acknowledgments. I get to be the talking head. I'm privileged to be able to do that. But this is the team of people in our clinical program that we've built, and the leaders who have done this are all here. So I want to walk through that, so if we can get the lights down. And let's start off with what's personalized medicine. So these two individuals, Shaq O'Neal and Danica Patrick, are 99.9% identical to each other, despite the big differences between them. It's true, at the DNA level. They only differ at between 4 to 6 million base pairs. That's it. Out of billions. That's all that they differ. Okay? Now, personalized medicine is based on the following, on average. And so what do I mean by that? Here's a silly, stupid example. These two individuals have a headache. They're both adults. They go and they read the aspirin bottle, and what does it say? It's about averages. Adults take 2 aspirin. Now, do you really think that Shaq O'Neal should take 2 aspirin? No. He should take 4. How many should Danica take? 1. Okay? What do the directions say? Take 2. That's how we practice medicine. And it's not the physician's fault. That's the tools that we give the physicians. Would you get on an airplane, I don't care how good the pilot is, that didn't have a blueprint? You go to see a physician who doesn't have a blueprint. We're asking them to do the impossible. Now, genetics actually isn't strange to medicine. In fact, you practice genetics every time you go to the doctor. It's called a family history. It just happens to be lousy data. Why? Because we never share data. I don't know how many of you know this, but Thanksgiving was designated by the Surgeon General to be Family History Day. I'm pretty sure most of us don't talk about that. So here's where we are, and where we want to go is change the practice of medicine. Now, with genetics, you can do all kinds of fancy things, and I'm sure you were all wondering at dinner, how long is all the DNA in my body? Because you want to talk about big data. DNA in every cell in your body is as tall as I am. It's about 2 meters. So, I got the wrong slides, I'm sorry. How about Adam and Eve? Can we use the DNA to figure out if there was an Adam and Eve? Forget the fact it says Wikipedia, okay? So it turns out it's true. Eve lived about 140,000 years ago, and we know this because all people have the same DNA in their mitochondria. You only get your mitochondria from mom. So how would you know if there was Adam? Well, it's pretty simple. Y chromosome is the only thing you have as a male, so we pass that on. So sure enough, Adam lived about 60,000 years ago. Anybody see a problem with that? Now, there's two problems that I can see, which is, one, Adam came first, and two, there's about 80,000 years between them. Now, I don't want to stake claim on anybody having to agree with this, but I've heard that probably some people in this audience would agree that those are the best 80,000 years of Eve's life. So this is what genomics can do, right? It can tell us amazing things. Now back to the DNA and how long is all of it, and we hear about big data all the time. So you give your physicians a big data problem. Because, right, one single change in one cell can cause cancer. So if it's 2 meters long and you have 100 trillion cells, it's 2 times 10 to the 14th meters. And Neil will say, Howard, that's a dumb number. You never give numbers like that because nobody knows what that means. So you're right, Neil. So what I did is I said, well, how far is it to the sun? It's 1.5 times 10 to the 11th. And of course, everybody in this room has done the math, and you now know that it's 1,333 trips to the sun. Now, I like the round trip number myself, which is a 666.5, which actually might explain a few things about humanity. So you give your physician, and I'm serious, if you put your DNA end to end, it's 666.5 round trips, and Sean has a pretty simple job. Sean, are there any mistakes in 666.5 round trips? That's his job. Okay, and then Liz has to find it on the data side. So with that information, is it even possible to do this? Well, you've heard a little bit about this. But what I want to tell you is we have no healthcare system at all. I'm not talking about politics. You see your doctor when you're sick. We have a disease care. I want to have a health care. We have reactive medicine. Somebody's sick, we see a doctor. This whole thing is talking about how do you do this. Now, here's the problem that you got to worry about. When you got an accounting company, PricewaterhouseCoopers, starting to define medicine, you know it's changing. So it's all changing. We need to move to a better way to do this. And how do we do that? So that's what we're here for, and that's about changing medicine. So this is Nick Volker at 2. You've been introduced to Nick, and this was an email that I got in July of 2009 that changed my life that talked about Nick. So that was Nick at 2. Here's what Nick looked like at 4. So Liz Worthy is actually who found this mutation, and it had a huge amount of impact. It basically says that this is going to change the practice of medicine. It's hard to read, but that's what it says. So it had a lot of things, and I didn't really realize how much it was going to end up changing my life, but this did. So this is the first time I got to meet Nick Volker. I'd never met him before. This is as he's being discharged from the hospital after he's had his bone marrow transplant. So we had spent 2 years wondering if this boy was going to die. And he said to me, "Are you tough?" And I said, "Not as tough as you." And at that moment, he stuck the spear in my stomach. That changed my life, and I mean that seriously. At that point, I realized we must do a better job. And this is Nick at 10. So I felt that we really needed to change this. And I had written on my whiteboard, which is still there today, how many Nicks? Now, that might not sound like very good English. So is that how many Nicks are we going to save? How many Nicks are affected? What does how many Nicks mean? Well, I'll tell you that the next thing that happened is we got a lot of media attention, and Nova came to us and said, "Hey, can you do a show and follow it live. I said, oh, you don't want to do that. We'll fail. We're going to fail on national television to try to solve this because this is really, really hard. And they convinced us to do this, and this is Andrew. So we sequenced Andrew's genome, and we had cameras running around us as we were trying to figure this out. So if you go and watch this NOVA program, Cracking Your DNA Code, you will see that we successfully fail on national television to find a mutation. And I think that was absolutely the best thing that happened because it pointed out that this doesn't work every time. Nick wasn't necessarily an exception, but we're a long way from this working every single time. We have a long way to go. And then you see a lot of media. There's a lot of hype around this. Do you want to do this? So what we decided to do was, rather than hype this up, was let's just build a clinic that does this. Let's simply ask the question, can we build a clinic and practice medicine with it? And with David Bick and the team, we did that. So we built the first clinic that enables us to go from sequencing the DNA, analyzing the DNA with our patients, for our patients, to change medicine. Now, I'll tell you, when Nick Volker was published, we were accused of being cowboys and irresponsible, and those were the compliments. And I'm serious. People felt this was absolutely the wrong thing to do. But we went forward anyway because we believed it was the right thing and our physicians wanted to do this. So we talk about the physicians, we talk about the patients, but personal medicine to me is because you're going to have to make decisions about what are you going to do with the data. And I want you to listen to this family who talks about their child and what it meant to them.
Our whole life, since Lillian's been born, has been kind of like a roller coaster ride. She was born at 30 weeks, 1 pound, 4 ounces, 11 3/4 inches long. She was ill several times in the NICU. She was tested for Shwachman-Diamond syndrome. She's been tested for cystic fibrosis. She slowly stopped eating anything by mouth, and we just did tube feedings. She's had 3 colonoscopy endoscopies. I can't even remember all of the different things she's been tested for.
Many institutions. They had been seen by many doctors. They'd been seen by geneticists. They've been seen by all sorts of other subspecialists.
She had been through so many different tests, and with them all coming back negative, I think that at times that they wondered if they ever would find a diagnosis.
She became sick in fall of 2010. I remember looking at her one day and feeling like she was dying in front of me. She had gone from 24 pounds to 18, and they couldn't figure out what was wrong. So that's when we came to Children's.
You know, the whole concept of the whole genome sequencing was new to us.
Genome sequencing is a process where we examine or we look at all of the genetic material, all of the DNA, all of the instructions that a person has.
Its purpose is to help us diagnose children when we've not been able to find a diagnosis before. Many physicians suspected she might have a genetic condition.
She really fit many of the criteria of a patient who had an unexplained disorder and for which there may be potential treatment strategies.
Genomics is almost our fulcrum, if you will, to the reach out to the many specialties that our genetics program supports.
One of the remarkable aspects of whole genome sequencing is really the range of patients that we've been able to help. Patients with intestinal problems, patients with immune problems, patients with neurologic problems, patients with cancer. The list goes on and on.
If they could find something that would tell us why Lillian is who she is and why she has the problems that she has, that was our number one thing.
Anything to give her a better life.
When we finally found the molecular diagnosis for Lillian through her genomic sequencing, we were just ecstatic. I couldn't wait to pick up the phone. I couldn't wait to call them.
She's the first child that's been diagnosed with this in the United States. She's unique. The diagnosis is unique. We have an answer. It gives something for the specialist to continue to look into, to see what they can do to to better help us.
Lillian has made tremendous progress over the years. Every time I see her, she's doing better and better.
By doing the whole genome sequencing, we don't have to keep searching. If it weren't for Children's Hospital, we're not sure if Lillian would still be here with us today.
So, I call that personal medicine. They could stop looking. We have mothers usually, not just mothers, say to us, at least I know it's not my fault. I think that's medicine. And I think what we have to do is continue to look forward on this. And so, when we started thinking about Nick, and people didn't think this was a good idea, I'm happy to tell you now that hundreds of children have now gone through this program. But how many are there? Rare disease, I mean, how many people does that impact? So how many are out there? So rare disease means there's less than 200,000 cases, okay? And does it save money? So here's just a quick example. Nick, their family went bankrupt on this is before we had accountable care solutions for them. More than $2 million went into Nick. He was misdiagnosed. He shouldn't have lost his colon. Nobody made a mistake medically. Nobody knew. We had another case where they wanted to put a child to go through a transplant that the child was going to die anyway. So the child didn't get the liver transplant, and it went to another child. The liver that was going to go to this child. So that saved money and it saved pain and agony for the child. And we have another example of where these 3 kids were going to get put on a drug that cost $600,000 for the 3 kids per year. So if you just look at the money on that, there's about $6 million that went into that for just these 3 million patients. And if you look at $6,000 as a clinical price to be able to look at this, that would have paid for another 1,000 genomes. And if we had done 1,000 genomes, we would have found solutions for another 250. So the economics are there. Why aren't we doing this? Why isn't this happening more and more? So people are trying to figure out how to do that. And we're leaving the Medical College of Wisconsin, not because it's not a great place, it is, but it only enables us to help one set of patients in one place. Here, we have the ability to work with UAB to be able to do the same thing that we were doing there, but to help others around the world. That's our mission. Around the state, around the world, around the nation. Because rare disease is not rare. 20 million Americans go from hospital to hospital, doctor to doctor, trying to find an answer. And there are people in this room who have been through this. There's at least 7 families in this room that have had this. There's 400,000 Alabamians who need this. We just simply need to do better. And this is the team that can do that. And this support and this organization and our partners at UAB and other physicians around the state are going to enable us to do this. So we're all celebrating as scientists that there's going to be about 250,000 genomes that are going to be done this year. It cost $1 billion 12 years ago. So that's fantastic. But I'm not happy with this because there's 20 million that need it today. There's 300 million Americans and there's 7 billion people that could benefit from this. So how do we get this to the masses? How do we get this so every physician has a blueprint? It's a simple thing. How do you do that? Well, you're starting to do this yourself. If you're wearing a Fitbit, if you're measuring all your stuff, you're starting to collect this information. Imagine the intersection points between them. Imagine what's going to happen with that data. How could that data be used? Well, I'm going to guess it could be used a whole bunch of different ways. So wouldn't it be nice if there was an app on your iPad? Well, wouldn't it be great if you could just sit there and pull out your iPad and say, I got an app for that? Well, I do, but because I forgot to tell the tech guys we're going to do this, we're going to do it on slides. So just pretend you're looking at my iPad. So this is my genome. That's me. Here's the interpretation. We built this at MCW. We're going to go in and take a look at this. And here's all the things I'm a carrier for. So we know this. Okay. Now the big thing for me is that my mom had breast cancer. My grandmother had breast cancer. I have a 20-year-old daughter, and I have an 18-year-old daughter. So should we go look to see if they're carrying the BRCA1 and BRCA2 gene, you know, with Angelina Jolie, and the challenge that Mary Claire threw out? So how many do you think I should type in right now breast cancer to look up those genes? How many think I should do that? How many think I shouldn't? How many think I should ask my daughters first? Oh, we didn't think about that. Here's the problem. It's not just your genome. Your genome's valuable to you, it's valuable to your family, and it's valuable to society. So fortunately, both of my girls agreed that we could do that. So we'll type that in. So we type in breast cancer, and up comes a variant in bracket 2. So what do we do with that? Well, we go in and we look at the data, and we find out that it's actually a very common variant. This is the most common variant that sits there. So it's not causing disease. But that doesn't mean we're necessarily out of the woods, because you see all those striped lines in there? That's all the variation in my bracket 2. We don't know what it does. So not only do we have to think about how to measure it, but we have to think about how do we figure out what's wrong. Now let's imagine sequencing more people and learning more about this and solving this problem. So now I would know, are my daughters at risk for this, yes or no? Here's all the hospitals in the United States. There are 3 that have a clinic, 4, I guess I should say. Forgot Kansas City. There's 4 that actually have a clinic and have the technology they're doing this. I think that's wrong. I think we should have this everywhere. And the mission here is, this is Alabama. Those are all the hospitals in Alabama. And we've got many physicians. How many physicians in the room? Would you please stand up? Come on. I saw you run over here, so I know you're in here. Selwyn, you need to stand up. I know where you're sitting over there, Selwyn. Okay. So that's the dean of UAB. So we've got partners here. So our job is to get these guys and gals the best medicine. That's it. This is about patients. How do we get this to everybody who needs it? 400,000 people in our state. I can say that now, our state. Okay? How do we do that? So here's Nick. I'm pretty happy about Nick. Andrew, we failed, but guess what? With time and more genomes are sequenced, we solved the problem. We now know what's wrong with Andrew. Here's one that disturbs me. This is Avery. If Avery had been sequenced on the day she was born, we would have realized she had a metabolic disease that was treatable. She didn't present clinically the way that it should be. We didn't treat her. Nobody made a mistake. It just wasn't clear. She has irreversible neurological damage. But the good news is we caught it, so she has a future ahead of her. So we can do this. How do we do this? Should we do this at birth? Should we not do it at birth? When do we do it? Fundamental questions that we have the ability to proceed with. Here is Jack. Jack is an artist. And I have his little thing right here. And what it says is, remember me now as I grow and as I play. And they put together golf tournaments for us every year. And Jack is perhaps not similar to many of our children, but I'm going to say he's a pretty normal boy. He likes to play on the playground. He likes to ride bikes. He plays soccer. And he's not too sure about women at this point. So, I went to Jack's funeral on Saturday. We sequenced his genome. We don't know what's wrong with him. It's just unacceptable to me. I mean, no one's made any mistakes, but we need to sequence more genomes. We need more people to do this, and we need advocates in the community. We need to tell the story. We need to help 20 million people that don't have access to this. And what troubles me is not just the loss of one life, but Todd, his brother, has the same thing. So, you invited me, and you invited my team to join you. And we're joining you for a reason. This is the place, with your help, and I don't mean just your checks. We won't be sad about that. But this is about how do we do this? There's talent in this room. Software, apps, advocacy, fundraising, support, ethics, surveys, You wanted us here, we're here. And I'm happy to be here. So I'm going to finish then with, inside the bags that you're going to get, you have a little card. And on one side it says, how many nicks? How many nicks are we going to save, and how many are we going to find? And the other side is Jack. It's artwork. And I want you to take this and put it somewhere. And I want you simply to say, flip it around. Which one? But let's do this. Thank you for your attention.